You know what I think I'll do is I'll call the meeting to order uh, while Paul tries to continue to get on. I just need to make sure that the majority's here. So Tyler, you're here
Yes, I am.
and I'm here. I make a motion to start the meeting.
Second.
All those in favor? Aye.
Aye.
Okay. I'll very quickly try to go over the minutes of the last meeting, which was on February 11th, 2021. Present was Mark McDonald, Chairman, Paul Armstrong, Vice Chairman, Tyler Nims, the Clerk, Gary Russell, Assistant Director, Valerie Blinn, Admin Assistant, Peter Falabella, Consultant. Board of Health meeting opened at 2:10 p.m. Mr. McDonald mentioned a motion to open the meeting. Roll call was taken on the board. Mr. McDonald started the meeting by voting to hire Ms. Jean Marie Joyce as the Board of Health's new director. The vote was seconded and was unanimously yay. Ms. Joyce will start on February 16th, 2021. Welcome, Ms. Joyce. The next topic on the agenda was the vaccine clinic at the Marshfield Fairgrounds. The clinic started Monday on February 8th, 2021. At this time, it appears that the clinic is running smoothly. The town administrator is hoping to be able to vaccinate 600 people per day. We understand that a supply of vaccine will run out this Friday. It was explained to the board that the second phone line was added to the town hall directory to take names and phone numbers of people needing help with registering for the vaccine. The plan is to have the Council on Aging retrieve the phone calls and assist those needing the vaccine. There is a request for volunteers to help at the fairgrounds. Presently, we believe they have about 200 volunteers. Mark McDonald will visit the fairgrounds after the meeting today. It is proposed that Paul Armstrong and Tyler Nims will visit the fairground at a different time. Mr. McDonald moved the meeting on to discuss the 2021 virtual MEF Marshall Education Foundation St. Patrick's Day 5K walk, run, race proposal. Mr. McDonald read the letter from the MEF dated February 5th. The proposed virtual race, 17 days between March 17th through April 3rd, 2021. The letter estimates around 250 to 500 people over the 17 days. They will be required to follow the state's open.
You want to pick up?
Hold on one second. Hold on. 17 days between March 17th, April 3rd, 2021. The letter estimates 250 to 500 people over 17 days. They will be required for, yes?
Okay.
They will be required to follow the state's.
Hang it up right there, if he's on.
Open space for phase 3, step 1. The entire board approved the virtual race as long as it is conducted as described. Mr. McDonald suggested that the race could raise more money than before. Mr. McDonald moved on to new business. Arthur Pat's Ice Cream wants to have an outside venue with bar food. The food would be from Fetch Barbecue. The tables would be spread out, proper lighting and cleaning. They will need to use single-use items and propose to call the location the beach. Town Council, Mr. Galvin, will send them a letter explaining all the steps needed to make this happen, including the use of the tent. The next topic involved Stellwagen Beer Company. They are using food trucks that will need to be inspected and licensed. There may be a concern with parking at that site. Last but not least, Mr. McDonald announced that the Board of Health hired Hannah Buckley and Teresa Flynn as our part-time nurses to work with and be trained by our current nurse, Nancy Macello. There are 3 other nurses the town hired for the fairground clinic. Teresa will also work at the clinic at needed. Meeting was adjourned. Motion to accept.
So moved.
Second. All in favor?
Aye.
Aye. Okay. Okay, moving on. Well, welcome, Jean Marie, to your first meeting as the director. So with that being said, we're going to review the Governor Baker's 311 and 322 reopening. Would you like to take that up, Jean Marie?
Sure. Well, as of March 1st, restaurants are no longer subjected to the percentage seating capacity, but they still have to put the following limits in place. The 6 foot between tables. Musical performances are allowed in restaurants, but they can't sing. 90-minute time limit on tables stays in place. And the limits of having no more than 6 in your party stays in place. So that's probably going to limit the number of people that can be into a restaurant.
Correct.
All right. So that's.
Did you skip over face coverings?
No, that's not actually even listed on here. But yes, I would say face coverings to and from tables.
It's on mine. It's on mine. I'll read it for you. Face coverings are worn, removed only when seated and actively eating at the drinking. That was one bullet that was missed on yours, but I do have it on mine.
Okay. Food courts remain closed. And then the other effects are March 22nd, subject to public health data. They're opening up the events and public health settings. And so you're allowed 100 indoors for weddings and events and 150 outside for weddings and events. Private houses and private parties still stay at 10 indoors, 25 outdoors. Then it goes on to indoor and outdoor stadium areas. Ballparks will reopen at 12% capacity. A large venue is defined as having a capacity of 5,000 or more. And they have to submit a safety plan to the Department of Public Health. Overnight camps will be allowed to open for summer 2021. Exhibition and convention halls can open subject to gathering limits and event rules. Dance floors can open at weddings and events only. And the other phase 4 industries that can't open until further notice are road races, street festivals, parades and fairs, amusement parks, theme parks, outdoor water parks, indoor water parks, indoor-outdoor ball pits, saunas, hot tubs, steam rooms at fitness centers, health clubs, and other facilities, beer gardens, breweries, wineries, and facilities, bars, dance clubs, and nightclubs, venues that offer entertainment, beverages, or dancing, and don't provide food and seed service are still closed. So based on that, I think we're in good shape.
Very good.
The only other thing I have to say is it kind of segues into this was had a quick conversation with Jane Landry. She's the nurse at the schools. And we were talking about what the seniors are going to do this year at the end of May. So it's really preliminary, but they're proposing an outdoor senior day. 3 big venues, 3 different areas. One area is at the stadium. One area is in the park, like a parking lot, an outdoor track. And another area is in a big field. They'll be doing senior activities at the stadium with a 6-foot clearance between all the kids. They'll be doing cafeteria style outside eating with food trucks, with the same setup that they have now to eat in the cafeteria. And then the third area will be disco dancing, like line dancing. So you have the separation of 6 foot between the kids and the groups. So that's the proposing. Then we discussed prom. And I feel the prom will be at Marriott. So it will be subjected to what the Marriott has for their limits and their capacity. You just kind of leave it at that and let the principal decide or the superintendent decide how they're going to deal with that. Because they have like 300 kids in their class. So
I'm not really sure that has anything to do with us, correct?
It doesn't. It's an FYI.
No, I got you. Now on that FYI, if I can back up for a second, do we have that proposed plan for the senior event? Do we have that? Did they give us that proposed plan? Because that is going to take place on their property, correct?
Right, and probably the last week of May, they're thinking.
So we'll need that proposal in writing.
That's what I said to her, because they're just getting now to set it up, getting the food vendors and giving us the names of those so we can remind them of getting the trucks inspected and getting the food licensed.
Great, because I'd like to, no, we're definitely gonna have to sign off on that.
Right, right.
Okay, great. So can you get her that message that needs to be done?
Yeah, I gave her that message. She's just flying by the proposal, real preliminary proposal to us.
Okay, that's fine. Great. Okay, so again, the prom really doesn't have an awful lot to do with us. COVID-19 restaurant procedures, do we want to kind of bat that around a little bit?
Yeah, you want a summary of what we should be doing and what they should be doing, and there are always bumps in the road.
Yeah, I mean, it's, with all these changes, that there's some confusion out there, and I know you just clarified it with us, but there's some confusion out there that because the governor's going to start opening things, or did open things on the 1st and again on the 22nd, they're all of the opinion at this point right now that all the other stuff around them goes away with it, but it doesn't. The only thing that really changes is their capacity.
Absolutely. Yeah.
And I know we put a letter together to send out to them. I've asked you about it, and I just let Tyler and Paul know. I know Paul's not on yet, but Tyler, what I'm thinking is I'd like to see if we could get a big Zoom meeting together, the board and all the restaurants and clubs, and kind of go over this a little bit and answer some questions if some of the owners and managers of the clubs have any questions, because they have to still follow the guidelines of the state as far as COVID-19. They still have issues that that do come up, and at this time, if you don't know, and I will mention, the Ming Dynasty had an issue this past Friday. It was a CTC issue. They passed it down to us, and we had to kind of go in and mediate a better result than what it first started out to be. But it did turn out to be an okay result when it was over. Up to that point, it wasn't too pleasant, but we got it done. And thank you, Jean Marie. Then a few days later, we had another restaurant that had an issue. Jean Marie called me right away on Monday, and I think it was Monday. It might have been Tuesday morning. We had another restaurant that had an issue. We jumped on it right away. We had the owner on the phone, communicated with him. He absolutely positively adhered to the request we were making, and he got it to us really quick. We had it resolved within 24 hours. So he did what he needed to do, and he was back open. And one of the things, Tyler, that a lot of things that has to happen is, one of the main requests that we're asking these restaurants for is a list of employees. And by that, we can hand that off to our nurses, or they can hand it off to CTC, and then those names can be matched up against the lists that are coming from Maven, and we can make sure that everybody that's employed by a restaurant is safe for the public to be going in and using the restaurant. So it's just little small things that they got to do, but I think we got to get that message to them, because, again, when we asked, this is the one of the restaurants over the weekend was the second restaurant in the past month or so, or 2 months, Gary can attest to that said they weren't going to supply the employee list. It's and I guess the end result should not have, if you don't want to abide by the request, then I guess the alternative for a restaurant is says, fine, you don't have to abide by our request, but by not doing that, we can't tell if your employees are infected, whether they passed it off, whether a patron passed it off. So, your options are to deep clean and close for 14 days and make sure your employees are all safe to work. So there's just some confusion there. I don't know, Jean Marie, if you want to touch on that a little bit, you can.
Yeah, I mean, we had two different results on two different restaurants, and both of them, we were looking at probably 12 to 19 different cases of infection that kind of came from there or associated with those restaurants. And it was really important to sanitize so you stop any infection, and also to protect both patrons and employees from it. But they have to supply the list of employees so we can check it against our list. And if they don't live in Marshfield, then it has to go to CTC, and CTC has to check it. So I mean, it's a big different results. But once it gets steam cleaned and once that we get that list, then we can reopen them and they're fine. We've stopped the infection or any source.
Right.
That's what's important.
Any thought on that? Any thought on that, Tyler?
I mean, that sounds reasonable. You look for the infections, the association of who might have been in the building with them. And once the building's all sanitized, I don't know what the time period, 7, 8 days or whatever, and then get them open again.
Correct. I mean, the way it works right now, Tyler, is the second restaurant this past week asked to have the restaurant closed. They did that. We asked to have a deep clean. They did that. We asked for their employee list. They did that. They remained closed until we checked their employee list against the Maven list. And once that was accomplished, they were allowed to open, provided that, we made sure all the employees were all good. And we had to hold off on one employee, but it turned out that everything was okay with him. And we called the restaurant owner and said, you can open back up. And like I said, he was open within 24 hours. That's the way it should work.
Yeah, that sounds reasonable.
Yeah. So, all right. Well, I'm working with town council on making sure that that's a request that we can make. I did put a question into him for that. I did not hear that. The second question, Jean Marie, I asked him was, I can't find it, nor anybody else that I know can find it. In Massachusetts, an employer cannot make their employees test for COVID. I couldn't find that answer anywhere.
Okay, we can ask that, but I want to just step back a second. Under the general Massachusetts regulations of isolation and quarantine, whether it's COVID, hepatitis A, B, norovirus, SARS, or any of the infectious or contagious diseases, they have specific quarantine and isolation regulations they have to follow. And we have a right to ask them. For instance, if it was hepatitis B, we would be required to test all the employees. It's no different. It doesn't matter which one of those diseases it is. That is a requirement of their license in isolation and quarantine regulations.
Okay.
We're not doing anything different because it's COVID than we would if it was hepatitis, AIDS, SARS, any infectious disease.
Okay.
Viral pneumonia, you know, anything like that. Salmonella, take your pick.
Okay.
So it's under the general isolation and quarantine regulations, not under COVID.
Okay, that's why, so my guess is, if I'm understanding you correctly, under those general guidelines, they didn't need to make it for COVID because it falls under those general guidelines.
It's considered an infectious contagious disease. There's a little blip in there that says whether CDC or Mass Department of Public Health considers it a contagious disease, you must do the following.
Okay,
The same thing would happen with the hepatitis outbreak. And those have happened many years around the South Shore. I'm thinking of the ale house in Abington that happened. They were closed for 14 days while all the employees were tested. So you take it away from just being COVID and bring it to the fact that it's an infectious contagious disease.
okay,
And this is the procedure that's always been, that historically has been followed and will be followed.
okay. I buy that.
That's routine when you have an
Okay.
outbreak. Yep.
All right. Well, let me keep working on seeing if we can maybe do some of these restaurants pretty quick and see if we can get them all together and see if we can help out, whether it's by a letter. I know we got one drafted, right, Jane Marie?
Yes, we do. Yep.
Yep. So, okay. Do you want to give an update on the vaccination clinics?
Well,
I
the-
did-
So when the fairgrounds is running, and aside from the appointment website, it's running well. People are very, very happy about, they can get in
That's a
through
good
that in about an hour. You know, get a vaccine and get watched and out of there in an hour. And then we have an email that goes out, the town does, to give them their second dose. We have senior clinics coming up that were put together by Carol Hamilton through Stop and Shop pharmacists, March 10th. And that will be at, oh, Gary, what is that? Grace Wrigley House and
Grace Ryder.
Grace Ryder House and Tea Garden?
Yeah, the
Tea
Tea
Gardens.
Gardens.
So it'll be done in their common rooms.
And what's going to happen there?
Well, a pharmacist comes in and will be giving those residents the shots right there at their site.
And that's only at Grace Ryder and T Rock Gardens?
Yes. Yeah, March 10th is the first dose.
What happened with the other Winslow Village?
I think they're just doing one at a time so that they start getting the rhythm going. It's starting
Okay.
to start flying.
Okay,
It's coming through Stop and Shop, and the recommendation is people think they have to go to the public Marshfield Fairgrounds, but a lot of CVS and Walgreens are now having their own clinics.
right.
And if you get your medication there, it might be better to go there. They already have all your medical information.
Yeah, I saw Osco had 30 vaccinations the other day. I was in the store at Shaw's and they were able to give 30 vaccinations out.
Right. So
So,
people might have better luck at these other sites.
all right. So on the Carol Hamilton side, the senior side, the senior clinic, who's orchestrating that? Carol?
Yes, that's what the information came from her.
Okay, so can we ask her the question of Winslow Village?
Yep.
And we need to probably ask them about, give me 1 second. There's two other places. One is, Gary, out behind Rexham General Store, Ocean's Edge. Gary?
Honestly, I'm not sure what it's called.
Ocean Shores.
Okay,
So we want to check with her on Winslow Village, Ocean Shores, and I probably would make a pretty good guess to check with Carol about the two buildings. One's on the corner of Parsonage and Webster,
oh,
and the other one is on Parsonage across diagonally across from the DPW barn. Prince Grant.
Okay, I'll check those.
All right. I just think I want to make sure that we get, if they're going to do it, we got to make sure that they have those in their focus.
Okay, sounds good.
Okay.
Yep.
Now, what's going on right now with does anybody know immediately with the clinic? We're not taking any appointments right now. We're only focusing on the second doses, correct?
To my knowledge, yes.
Okay. Do we know when we'll be taking appointments for first shots?
I really
No?
don't know. I would
Okay.
think it's gonna have to be like close to 21 days later.
Okay. All right. So maybe we can get an update from the on-site people there, but that's okay. All right. And then, thank you. Upcoming license renewals. Jean Marie?
We have appointed
May I add something to the last item?
Mr. Huntley, yes.
Yeah, Mr. Chairman, and committee members, I'm attending this meeting because of my frustration of trying to get an appointment for my first inoculation sort of boiled over earlier in the week. The frustration, and I'm 74 years old, and I've been trying ever since 65-year-old plus were allowed to get their inoculation. My frustration is with the websites that show that there are openings, and then when you go for a time slot, there aren't any. Now, I can understand there may be some lag, and then maybe they've been blocked off because people are faster than me with their computers. But my frustration boiled over on Tuesday evening after I was euphoric because I saw on the website that there were more than 240 openings per day this week from Wednesday through Saturday at Marshfield Fairground. But when I tried to book one, the main site, which is the maimmunizations.org, PrepMod, said very simply that there are no more appointments, everything is filled up, and I couldn't proceed. The following morning, I tried again. The number had gone down slightly of availability, but I was still unable to actually sign on to anything. That's when I, that evening, took shots of those screenshots of both websites and faxed them to the Board of Health with a cover note. My frustration was then topped later in the day yesterday when I actually saw openings in Marshfield, because I keep checking every so often, though I can't do it all the time because I work part-time. Then I tried to book one at 2:30 today and was about 3/4 of the way through when the connection was lost and I couldn't get back in. So my request to you is that you probably have more influence with the state and the people who run these websites than I do. In fact, I'm sure you do. Can you please sort of raise this issue to try and make it smoother? I understand we have to wait in line, but it really drives us nuts. And I'm just one person, so there must be a few dozens more in Marshfield and maybe hundreds in Plymouth County and thousands across the state that have the same frustration. My second...
I'm one of those guys that's frustrated with you because I have a brother that needs a vaccination shot. And I went on the other day to sign him up. And I went from 1 minute to 5,888 minutes.
I beat you. I got to 7,000.
So unfortunately, I don't have the answer for that. I wish we, and I think anybody that's part of our COVID task force team can actually say the same thing as me. We don't have an answer for what's going on with this prep mode system, because now I understand the prep mode system is down or was down, and half the time it's probably down more than it's up. Did you try the 211?
I did that evening, and I felt a bit guilty about it, but because I could do it online, but I was so mad. I waited 25 minutes, got a very nice lady. She tried the same thing, and she said, "Yes, I can see these openings, but it's not here, so I can't book you." What she then said was that she's seen that problem with a number of sites where in one site it says there are openings, but there's a delay or, some considerable delay of getting them up, what she said, uploaded to the other sites. And it was after that I actually put the letter and the material together and faxed. I have to say thank you, though, for the new director's response, because she called me back the following day. And also to thank you, because you obviously put my name to the senior centre, because they called me for my age or date of birth. As I gather, you are going to be sort of more proactive. So my other request would be that anything you can do, like Brockton I know has done, to actually be proactive for senior citizens and help them get scheduled appointments, particularly, in Marshfield, where we have this one, the wonderful fairground set up there, which can handle so many people. So that's why I'm on the call. It's really just to say, frustrated. I can't be the only one. Don't know what you can do to help, but thank you for trying.
Well, thank you very much for your input. And we're if this might be hard for you to believe, but we're probably a little more frustrated. We're probably a little more frustrated than you are, because, again, we all have to realize we're a much larger site. We're taking appointments from all over the state by the looks of it. I went by yesterday and saw a big sign on the side of the fairground fence. It said, "Welcome Massachusetts residents," whereas probably Brockton is more focused on just their residents. I do feel your frustration. I know Carol Hamilton over at the senior center is trying to help out. I hope you can get on one of those. I think, from what I understand, their wait lists for vaccines that people who don't show up. We have, Ms. Donnelly, we have not, Marshfield, since they've opened their vaccine clinic, we have not wasted one bit of any of those vaccines, not one. And we read in the paper that Gillette Stadium's throwing them away. They're not drawing on them the right way, and they're throwing a lot of good vaccine away. Marshall has wasted zero. So we're trying, we're getting there, and hopefully the state will, and the prep mode people will step up their game a little bit. Unfortunately, it's not, that prep mode is not in our hands to control. All we can do is try to get you in touch with, like we did with the senior center, the seniors, and I'm glad she reached out and they reached out to you. The only thing I can say is be patient. That phone calls may be coming to you to get in your car and get to that fairgrounds quick so we don't waste any vaccines.
Oh, I will. Don't worry if I get that call. I appreciate it. No, I just thought maybe you had an avenue through, as the Board of Health for Marshfield, through to the state level to actually pass on the frustration and ask what's going on.
Oh, they know we're frustrated, and I'm sure the people that prep mode are frustrated as much as you are as well. But again, I apologize. Keep your phone near you, and hopefully you get that call, and we will pass on. I don't know if Jean Marie or Gary want to add anything to that.
No, we are frustrated. We don't have control over prep mode or even when they deliver the stuff.
All right. Well, I appreciate all your efforts. Thank you.
Don't give up trying, okay?
Oh, I won't. I don't want to get it.
All right. Thank you very much.
Thank you. I'll sign off now. Thank you.
No, you don't have to sign off. You can stay.
Okay, thanks.
Jean Jean Marie, upcoming license renewals.
Well, we're getting to that time of the year when a lot of the licenses are now coming up for renewal. So if you want any conditions or change any way we do things, now's the time to sort of think about it before the letters go out, reminding them of their renewals. I think we were talking about dumpsters maybe and trash companies and trash haulers. Our septic
Yes.
people are required to send us the list of their clients. So we know who's getting it and where it goes. You can definitely do the same for trash haulers. As well as a reminder that it's their responsibility to keep the areas kind of neat and clean when they're hauling. That if the trash comes flying out, they probably should be going out to get it. And conversely, you can also lean on restaurants if we have a particular exposure that's a mess. So think about that.
Well, I mean, you're bringing up an old sore subject with me because we had a problem a few years back of a dumpster that was completely filled up on Union Street, and evidently the contractor or whoever hired that went up. He didn't get paid, so he went up and he opened the back door of the dumpster and he picked up his dumpster, and by the time he was out the driveway, all the stuff was in the driveway and his dumpster was empty on his way back to his place. So this has been one of my pet peeves, being on the Board of Health, that listen, when a septic truck pumps out a septic system, they need to notify us, correct?
Yes. Yeah.
A dumpster company should be exactly the same. They should all be licensed, and we should know when they have a dumpster in our town and when they don't, because we don't want to be chasing a dumpster company that we didn't even know they had a dumpster in the yard and trying to figure out who it was. We were fortunate because someone did find the name of that company and they rectified the problem. But if we don't know who's coming in town or who's putting dumpsters in, then, I think we have a list, don't we, Gary, of who's got
Yeah.
dumpsters in,
We have a list of the dumpsters in town,
that are licensed.
correct?
So if somebody that's not licensed puts one in town, we don't know about it, correct?
Unless we do a drive-by and spot, the name and compare it to our list, yes.
Okay, this is a conversation we've had many times over the past couple of years that, Jimmy, I definitely want to work with you and make sure that we rectify this problem. And if there's a dumpster company in Marshall that's not licensed and has a dumpster in, then we got to figure out a way that we're going to be able to put some teeth in. Again, we'll have to ask town council, can we have DPW pick up that dumpster and get it out of where it is? Sort of like, what do they call that when they repossess a car?
Yeah. Yeah.
Yeah. So I think they need to abide by the laws, just like the septic, like All Town and all the septic companies need to do. They need to register with us, let us know when they're in the town, and then let us know when they leave, when they've picked it up. So I'm with you on that, and I will help you with that any way we can. Tyler?
Yeah, I mean, that sounds right.
And the other thing you might want to just add on there is where the dump site is. Are they taking it, down to CMAS, or where is it going?
I think it depends on what's in the dumpster, correct?
Right.
Yeah.
Most of it's food waste and garbage, well, restaurants would be.
Yeah.
Right.
But we also
The
require that
building.
the grease trap, we have to know where that's going too.
Yeah.
When they pump out grease.
Right.
There are special treatment plants. And we-
A good initiative, and I think we should work on that, okay?
Okay, sounds good.
All right. Anything else?
Not on my end.
Okay, I think that's it for now. Tyler, you have anything?
Nope, nothing else.
Okay. Gary?
I'm all set right now.
Okay, I make a motion to adjourn. Tyler,
Second?
all in favor? Aye.
Aye.
Okay, thank you, everybody.
All go